Hello, I'm urologist Omer Erdamakaya. Today I'll give you a short video presentation on penile prosthesis. Is it a permanent solution? Is it the last option? What is a penile prosthesis? A penile prosthesis is a plastic prosthesis that provides the erection of the penis, allows it to enter the vagina, and provides sexual intercourse. It is inserted into the penis. So how does the path to penile prosthesis occur? In the treatment of erectile dysfunction, we apply many treatments such as drug treatments, PRP, shock wave therapy, and stem cell therapy. Some patients may not get an answer from them. They even say, I took 2 to 3 Viagra, it didn't work. I used epimedium, it didn't work, stem cell therapy was done, PRP was done, I didn't see any benefit. And some patients need to have sexual intercourse frequently. They are young patients who are at the age of 30 to 35 who have these complaints. Generally, these patients have had diabetes for 10 to 15 years. For example, the patient is about to get married. He is 30 to 35 years old, has diabetes, and has erectile dysfunction. In these patients, penile prosthesis is the definitive solution. Or the patient is looking for a definitive solution, a solid treatment because he thinks that he will remarry at the age of 50 to 55. His wife will want sexual intercourse, and he will feel embarrassed towards his wife. Because the patient will not have intercourse 1 to 3 times a month, will want to have intercourse spontaneously, will not want planned intercourse. When saying planned intercourse, I mean that the patient does not want to say, I will take Viagra after a certain hour, everything will be ready for the time I will have intercourse. The patient wants to be able to have intercourse whenever he thinks about it. There is such an advantage in penile prostheses. What is a penile prosthesis? As we said before, the penile prosthesis is a plastic prosthesis. There are 2 varieties. One is the bendable one, so the penis is always hard, and you can only change the direction of the penis, to right, left, front, back. When you want to have intercourse, you turn the penis forward. When you do not want intercourse, you tilt the penis, you use it in this way. There are also inflatable models. These are pumped, and 2 balloons are placed inside the penis. Thanks to the pump placed in the scrotum, the patient can have intercourse by inflating and erecting the penis. These inflatables require a little more dexterity. It is a little more difficult for the patient to use them than the bendable ones. Well, we will have the penile prosthesis, but how much does it cost? The cheapest of the penile prosthesis, the bendable models start from $1,000, and the inflatable models can go up to $4,000 to $7,000. Prices vary by brand and model. If you ask, well, we will pay this much, what will our satisfaction rate be? In penile prostheses, post-operation satisfaction rates are over 90%. In other words, more than 9 out of 10 patients are satisfied with the penile prosthesis. In my own clinical experience, when I ask patients who have used it for over 10 years, a few of them say, Doctor, it's no different from the original. I have heard many patients say that their spouse is satisfied and that they are very satisfied. So are there any complications? What kind of complications occur? When we implant a penile prosthesis, there is a 1% chance of penile prosthesis developing infection. Since it is an externally inserted foreign piece, if the patient's body resistance is weak, for example, if the patient's diabetes is bad, we do not prefer to implant a penile prosthesis. We want to do the penile prosthesis implantation after the patient's diabetes level is regulated. Generally, infection rates are below 1%. Complication rates are low. How long is the operation period? The operation period is about 30 to 60 minutes. It is necessary to stay in the hospital for 1 night, we can discharge the patient the next day. After 6 weeks, the patient can use the penile prosthesis. As I said, penile prosthesis is the definitive solution and last option. But on the road sailing to penile prosthesis implantation, if the patient pays attention to his health and his lifestyle, maybe he will not need any prosthesis at all, he will be able to continue his life with other treatments. Thanks for listening, best regards.